So it now gives me great pleasure to introduce our next speaker, Dr. Charu Kaushic, who is the Chief Scientific Director for the Canadian Institutes of Health Research of Infection and Immunity. And she's a full tenured professor in the Department of Medicine at McMaster's University. And in her role as the Scientific Director for CIHR, Dr. Kaushic is responsible for making decisions in CIHR for strategic investments in infection and immunity on a national and international level. She also represents the CIHR and the Government of Canada at various national and international forums related to infectious diseases. And she serves as the chair of GloPID-R, which is a global consortium of funders in pandemic preparedness and emergency response research. And she also represents Canada on the JPIMR steering committee. And during the COVID pandemic, she's been closely involved in shaping CIHR's research response to the pandemic and is serving on the COVID-19 National Immunity Task Force. So it gives me great pleasure to introduce Dr. Charu Kaushic.
Thank you very much, Tracy, and it's a great pleasure to be here and to be able to speak with everyone today. So thank you very much for this kind invitation, and I'm going to be talking a little bit about GloPID-R, its work, and how we have responded in this unprecedented emergency in our lifetimes, and what we're doing to learn from what has happened and prepare for the future pandemics. So I'm just going to go ahead and get started. I wanted to start out by taking a little bit of a step back and thinking about, where we are in this place in history. So a pandemic is not a new thing for the humankind. We've known and there are historical records of pandemics and epidemics and outbreaks that have happened throughout our history. And I'm showing here some of the big ones that we have on record that have occurred over the past thousands of years. Starting with the bubonic or Black Death or the bubonic plague, which happened in the 14th century. Smallpox, I think all of us and many of us still bear the scars of having, had smallpox vaccinations, the Spanish flu. So you can see that over the years, many pandemics have occurred and have caused huge toll in terms of human lives to the humankind. When you look at the effects of these pandemics, there's the obvious effect of the huge level of mortality. And if you look at the three of the biggest ones, the bubonic plague at the time that it occurred cost about 51% of the human lives on Earth at that point. They also have huge population effects as well as economic effects, but they also change societies and how we function given our circumstances and where we are in that particular phase of human civilization. So with that being said, obviously there are lessons to be learned and have been learned through all of these different pandemics, which have the ability to shape the way we think and how we interact with each other. So political, human, economic changes occur in the context of pandemics, just like wars. There are big events that change the way humans and human society thinks. So with that being said, I want to quote here the context of the pandemics. And this is a quote from Dr. Frank Snowden, who is a professor in history at Yale. And he, in 2019, fortuitously, put this book together on epidemics and society from Black Death to the present. And I'd like to read out this quote that he said, that epidemic diseases are not random events that afflict societies capriciously and without warning. On the contrary, every society produces its own specific vulnerabilities. To study them is to understand that society's structure, its standard of living, and its political priorities. So I just want to bring that to the context that as we are learning, and we're not done with this pandemic yet, we have to think about our own vulnerabilities, the way we interact as a society with each other, also with the environment, and also with other animals and other beings that live on this earth. So with that higher sort of level picture, what I want to show you today is that the pandemic has played out very differently across the globe due to many factors. There's preparedness, capacity, funding, resources, political leadership. But if you look at this graph that I'm showing you of what we thought before the pandemic happened, so this is from 2019, and it basically shows what the consensus was in terms of the countries that are best and worst prepared for an epidemic. So you can see in this graph, the countries in light yellow, you can see North America, many places in Europe, Australia are all in very light shade. So the US, UK, Netherlands, many of the developed high-income countries fall into that bracket. And then a lot of the developing world is, was seen to be less prepared. And then resource poor countries were thought to be least prepared in terms of a pandemic. Here's the reality 2 years later. So the countries with the highest COVID-19 death toll as of October 11th of this year, you can see that the preparedness, what we thought was preparedness, didn't really pan out to be the reality. So again, I'll go back to that quote that, what it reflects is what is the state of our societies and our civilization and how we interact with each other around the world. So I want to transition to what are the learnings from COVID-19. So I'm quoting here the Global Preparedness Monitoring Board that highlighted in their annual report last year, which was appropriately titled A World in Disorder. What is it that we were learning? And that was 1 year into the pandemic. And they coded 6 different learnings. The political leadership, we know that makes a difference. And preparedness is not only what governments do, but also what people do to protect each other. We're seeing that being played out in spades right now across the different countries, in high-income countries, the issues around vaccine hesitancy and the ability to protect each other. The impact of pandemics goes far beyond immediate health effects. And I'm sure that we will be dealing with the after effects of the pandemic, even though we're not out of this pandemic. It'll probably take a decade for us to recover completely from the effects of this pandemic. Current measures of preparedness are not predictive, and I just showed you data for that. The return on investment for global health security is immense. And the GPMB board estimated that a year into the pandemic, the cost of the pandemic was around $11 trillion at that time and climbing. A year later, I haven't seen yet the estimates of that, but I'm pretty sure it will be at least double, if not more of that. The cost of preparedness, according to the GPMB, is about $5 per person per year. So even if we take into account that there's 8 billion people in the world, we're talking about $40 billion. So the investment in preparedness is a huge saving in terms of the cost of actually having a pandemic take place. The cost of lives and all the repercussions around the pandemics is huge. And then the final one that we're all very familiar with now, that no one is safe until everyone is safe. In terms of the learnings from the COVID-19 and moving forward, the calls for action, which I think are very relevant, and I wanted to review those today. And I think John Groves addressed some of those as well in his area of work. Responsible leadership, engaged citizenship, a strong and agile national and global systems for global health security, sustained investments in prevention and preparedness commensurate with the scale of a pandemic threat. And then the final one, robust global governance of preparedness for health emergencies. So in the rest of my talk, I'm really going to talk about number 4, which is the sustained investment in prevention and preparedness, and perhaps a little bit around governance in terms of how we prepare for health emergencies. So I will be presenting to you in the next few minutes the vision of GloPID-R as a meta organization. So basically, we are the Global Research Collaboration for Infectious Disease Preparedness, a consortium of research funders around the world that are in the pandemic preparedness area of research. And we bring together funding organizations that invest in research related to new or re-emerging infectious diseases in order to increase preparedness and facilitate rapid research response. And then accordingly, the objectives are obviously research preparedness, where we bring together funders. So it really is a funders forum to discuss with each other how we can invest research dollars in better preparedness for pandemics and epidemics. The second objective is really a rapid and aligned funding of research in an emergency. And then the third part is really sort of the communications part of it, to coordinate, communicate, increase visibility and capacity to be able to enable countries to be able to respond to pandemics and outbreaks. Just a little bit of introduction to the organization. The GloPID-R has 32 members across the world, and you can see on the right side where the members are. And 4 observer organizations, WHO, CEPI, EDCTP, and Essence, who are all in this space of pandemic preparedness. And you can see my colleagues, the co-chairs, who are also spread quite globally across the world in terms of coordinating what the funders can do in terms of preparedness and response against pandemics. So I'll spend a couple of slides just recapping for you, what GloPID-R has done during the course of the pandemic, starting in February 2020, where GloPID-R co-organized with WHO R&D Blueprint team a meeting in Geneva, which resulted in large-scale consultations with hundreds of scientists that gathered in Geneva, and the publication of the Coordinated Global Research Roadmap, which has sort of become the roadmap against which most funding has been correlated. And I will show you data for that. A few months later, we recognized that it's really important for us to be able to understand where the funding is going. So in collaboration with UKCDR, which is a consortium of UK funders, GloPID-R put together a live database that continues to provide, to date, an overview of funded research projects globally mapped against the priorities that were identified in the Global Research Roadmap. And this is what I will focus on today in terms of the evidence base and how that has led us to basically reorganize our strategic priorities towards the gaps that we have observed in the last 2 years. And again, a lot of knowledge mobilization activities. So 5 research synergy meetings were organized last year to understand what is the new information in the vaccine, therapeutics, transmission, and social sciences area, and to determine where funding needed to be directed. And then finally, in December, as the reports around long COVID or the post-COVID-19 syndrome was increasing, that was, again, a knowledge mobilization workshop that was put together to understand better what is the evidence on long COVID and its science, and to define the research gaps in order for funders and researchers. And this was published as well. And then just a few months ago in spring, we also put together, based on the gaps that we were seeing, a low middle income country virtual event to really bring together stakeholders from the LMICs to determine what are the priorities, research priorities for the LMICs. And it's based on that we have now moved forward to carve out sort of our forward agenda. But first, I'll take a few minutes to talk to you because this is an evidence-based platform, and I'm sure the audience is interested in this. The Research Project Tracker, which was a collaboration between UKCDR and GloPID-R, it's a database of funded research projects on COVID-19 from around the world, funders who are within the consortium and those that are outside. We invited everyone to provide us with data that could be in terms of what they were funding, what topics they were funding. So there's a complete spectrum of research projects that have been entered into the database aligned to the 9 priorities in the WHO's COVID-19 R&D priority roadmap. And to date, and I think this data is current, there's been over 13,000 projects that have been funded by more than 200 funders that are taking place around with more than 140 countries to the tune of about close to $5 billion. And you can see on the right side, the kind of information that is available, and the database is live, so you can actually do search strategies based on what you're looking for. And this database has served as a really important role in helping the funders determine what are the gap areas and where there is a lot of funding going, where's overlap in funding. So the plan is for us to, as we come out of this pandemic, to really turn this tracker into a pandemic tracker that's doing proactive tracking in priority pathogen areas that have been outlined by WHO. So it really is turned out to be a good enabler for collaboration and coherence. And I want to flag for those who are interested that this is a living systemic review that is available on the Welcome Open Research website. And you can basically see it's updated every few weeks to add more data into it. So I'll move to what kind of information
Charu,
get.
we just have 1 minute left.
Okay, so basically to determine, what kind of response the funders have given, and you can see here, for example, that there are different kind of funders, who has funded how much. One of the gaps that we identified was how little funding has gone to the LMICs. And it's in this context that we put together a collaboration with multiple funders and started a LMIC working group, which has really sort of focused on funder coordination, researcher coordination, and a learning living system from which we can learn to move forward. From that, in the LMIC research meeting, we identified key gaps that were identified by the LMICs themselves and where they would like to see research funding being focused. And listed here are some of those areas. And moving forward, GloPID-R priorities have then been sort of modified to adjust to these key priorities that were recognized and identified by the LMICs, where the coordination of funding initiatives is a big area that we are focusing on now, as well as the research preparedness and response, but really to move into geographical areas to include more LMICs to be part of the discussions, and then building capacity and strengthening across the world the preparedness and exchange of information. And I'll stop there and take any questions.
Charu, thank you. That was a rapid run through what has been an enormous amount of work. Thank you so much for that presentation. I think some of the key things coming out there are around the collaboration and sharing, and really looking at the priorities of the end users in here. So thank you for that. There are a couple of questions. One is around what are the plans to improve equity for the next pandemic? And I guess you've just touched on that in the latter parts of your presentation. I don't know if you want to make any more comments on that.
Yeah, just to kind of flag, so I didn't get into the details of it, but the plan is currently, and in fact, we're starting to run a pilot in the Asia Pacific area where there will be a geographical hub of GloPID-R, which is a consortium of funders located in different regions, one in Africa, one in South Asia, and one in South America, which will be local hubs that bring together funders and researchers in that area to determine more locally what is needed. And then the funders will then coordinate funding to the priorities that are identified. And there are, of course, in our consortium, global funders who are very focused on LMIC. In fact, 12 of our 32 funders have that as part of their mandate. So that's the goal. We've identified this gap, and this is going to be a priority now in preparation for the, when this occurs next time, hopefully not in our lifetimes.
Thank you. I think that will give some comfort to some people on the call today. I think one of the things that you mentioned quite a lot, and of course John mentioned, was around the leadership piece here. And I think you've demonstrated your leadership qualities in working across all of these different initiatives. And so on behalf of the audience, I'd like to thank you for your role that you've played in that today. It's been, it looks like it's been an immense period of work for yourself and your colleagues. So thank you on behalf of everyone. There are some other questions in the chat, but I think we can get to those later. We're running slightly behind time. So Dr. Kaushic, thank you so much for your presentation today. And we'll now move on to the next speaker. Thank you.
Thank you so much for this opportunity. I really appreciate it.
Thank you.